And I'd like to welcome everyone to the latest VIA Live product training. Today we're very proud to host MTTS to talk about their suite of neonatal products. Before we get to that, I'd like to talk just really quickly about VIA Global Health and what we do for those of you on the line who are new to VIA Global Health. So what we are is a medical equipment sourcing platform that helps you source, quote, purchase, and ship products from around the world and make it faster, easier, and more affordable for you to do that. And the way we do that is through our online platform. You can search for products. You can use any of our product categories from across the line. You can feature or search some of our featured products, which are typically those innovations in the industry that are either new to your market or new to the market in general. And then you can look through our training library, but you can also search for products here. So in much the same way you would want to find a product or anything on Google, you can type it in here and it'll pop up with a recommendation, or you can just click search there. If you want to learn a little bit more about VIA Global Health, you can search our About page and just see a little bit more about what we do, what we're about, what we believe in. You can also look at information like our latest news, our team, look at our Market Insights program or rewards program as well, or some of our training videos. So that's just a bit more about us. It can all be found on the website. We like to be as transparent and straightforward as possible because that's what we think that the sourcing process should be. So now let's talk again really quickly about the products we're very proud to be hosting today. So it's a suite of neonatal products from MTTS. So that's going to be your Dolphin CPAP, your Firefly Phototherapy device, your Colibri Phototherapy device, your Wallaby Warmer, and your infant bed, all available on the VIA Global Health site. So a couple of things you'll notice here on the product page is all of the product information you're going to need. You're going to see pictures of the products. You're going to see regulatory approvals, short descriptions, any key information, any graphics, longer description about what the products does, key features, any webinars, which we'll put today's webinar back up here today as well, so you can see that again. You can look at product documents, so any brochures, manuals, review any warranty information, and then specifications. So for us, what we're trying to do is give you all the information you need all in one place. So at that point, you just request a quote and you're ready to go. I think the only difference here is I would say for a verified distributor, what you would see is you'd log in and you'd be able to see all your pricing and generate your invoices and everything there. So very straightforward process. And that's what we're trying to do is streamline the whole process. So with that, I'd like to hand it over to Greg Dyer with MTTS, who's the product expert on all of these products, and he can take you through a demonstration and then take your questions after that. So Greg, I'll hand it to you.
Thanks, Brian. Good morning and good afternoon, everybody. I'm here in Hanoi from Greg Dyer from MTTS, and today I'm gonna show you our devices to get you a better idea how they work, how different they are, and why we think they are the ones that you're gonna like the most. Our probably most famous device called Firefly Phototherapy, ready for 1,000 units all around the world. And it's the beauty of this, it's extremely simple and efficient device. It's a double-sided phototherapy for neonatal jaundice that treats pretty much it's the fastest therapy I know on the market. It is because it's a double-sided, so you have the light from the top and from the bottom, and it is really, really efficient. So because we are able to cover a lot of skin here, and very strong lights, LED, carefully calibrated, we got the device that is doing amazingly good job. The control panel is very simple. It's just a button turning on the device and counting up number of hours. Not too many things to control. You just simply have to make sure that the patient have the eye patches on and it's under the therapy as long as it requires to go down with the bilirubin level. So this is our phototherapy unit. There is one thing that doctors know: the babies cannot thermoregulate. For the babies that have problem with thermoregulation, they are premature and they are not able to, not big enough to control. They need a heating. system as well. The Firefly doesn't provide heating, unfortunately, at this point. But for those, we use a little bit less efficient phototherapy, but it can go together with radiant warmer. So we have two devices in one. The Colibri overhead phototherapy that is specially designed to be used together with the devices like incubators or radiant warmers without losing any of the coverage of the body. Turn it on. And providing the same type of light that Firefly Phototherapy, with not covering the light, not covering both sides of the patient, unfortunately, but covering as much as possible for overhead phototherapy. We also have angled lights, so we have really nice coverage on the side of the patient, and we can do quite a good job comparing to other overheads. Control panel is extremely simple. You have the choice here of just on and off button and the control of the light intensity button. So you can boost it, the device, to stronger light. And these days with LED lights, it doesn't make as much sense as it used to, but it's still required in the public tenders and everything that we have to comply with. But in my opinion, this boost button is just to comply with tenders. Really, it should be always on boost because we can do it with these very strong and efficient lights. And it's all LEDs. And as you can see, LEDs is very strong light, very efficient. I'll just show it from this angle. And the unit like that. We can adjust nicely the height. I'm just doing that with all hands, so it's a little bit difficult, but you can see it's very easy adjustment with just one finger. You can lock it. With two hands, it's easier. And also not too many messy wires. So what we did, we ran the wire all the way down and comes from the bottom. So there's no hanging wires anywhere. You can see here that it's connection from the bottom. So that helps as well. Those details are really important for the places that are packed with machines and they have very little space. Now I want to present you, before I go to the Wallaby Warmer, I want to present you how nicely those two devices fit. We just roll them in together. And you can see, because we have that gap, there's no obstruction between the heat wave provided by radiant warmer and the phototherapy itself. So it looks like this. It's really, really cool solution for the places that have to be careful with the space. And we don't lose any of the coverage of the patient because we don't have to tilt the overhead unit, we don't have to put it on the side, and any of those things. And the way we design it, the Colibri Phototherapy, is the height, maximum height, and minimum height is perfectly suitable for most, like 95% of other incubators and radiant warmers in the market. So it really fits. It's not only our warmer it's compatible with, but also other ones. So very important function. Now I'm gonna remove that to turn it off and present the next device, our latest, our newest, which is the Wallaby Warmer. So this is a big device. Takes much more space than ours. Try to present it to you. The device is big, heavy, but where radiant warmers work. They have for resuscitation. They have to be good and strong devices for multiple use. It has all the functions that are required. Here's you can change the angle of the bed for different types of therapies. You can obviously open all the panels and perform the resuscitation procedures to have good access. You can, for X-ray procedure, it's possible to move this unit away, so both sides, so you can can perform the X-ray procedure as well. Nice and easy. And you have quite a few accessories that we provide with the device, and that includes the shelves. The shelves can be replaced with the IV poles. We install, this unit doesn't have it, but we install inside the drawers, and also on the back the holders for the cylinders, oxygen and air if that's required. And all those things are extra, and some of our customers really want to have them as well. Here's the traditional sensor, skin sensor, which is also designed specifically to be the most efficient, be close, not possible to make mistake. It has to be this side to the patient and reflecting the heat wave from the heatal element, and that helps also to monitor, regulate the heater power by the patient temperature more closely and precisely. Heater element is a ceramic. It's not the rod. It's this new type of we have, which are much more long-lasting, durable, and efficient. Very important. We have a bunch of sensors around, so it's very high-tech. We have the distance measurement sensor. We have infrared camera sensors. So we also monitor the safety of the patient, not only with the skin sensor traditionally, but we also have the additional sensors to help us make sure that nothing going wrong with the patient. So those things are very new and very popular on the market. Now it's time to implement in the medical devices. I turn on the device. It's except that it's quite traditional. It's a touch screen panel instead of regular panels that you are used to. And device, if you're familiar with the warmer, it's nothing really dramatically changed. You have the information about the temperature. You have 3 modes to choose from, and you have a pre-warm mode, which is set for 25% heater power, just to prepare the patient and make sure that it's ready for the procedures. You can also choose the manual mode when you just choose the percentage of the heater. And obviously, it's not the perfect way to control the temperature, but it's possible, and in certain restrictions related to that mode. And the most popular and the most appropriate mode is the baby control mode, which is 36, which is according to the baby temperature detected by the skin sensor. And we have a set point that can be chosen from, unfortunately here, but the room temperature is 27 degrees, 25.7, and we can regulate up to what we need. We have a light. It's a LED light as well. It's a white LED. It means that bulbs last forever, very long time. And we also have other standard things expected these days, such as course and procedure timers. So there are timers that you can choose as much as you want, counting down the procedure. So we have laid all the timers on. Heater power at the moment at 100%, because it's so cold here, we have to bring it up. So as you can see, it's quite standard, no device in terms of operations, but we have quite a lot of new gadgets that help to make it more precise and safe, especially for the places where nurses are. There's one nurse for 5 or 10 different babies, and they have really a lot of work. The design itself is also very nice and light, and very important to understand. We have an upgrade timer here. It's very important to understand that this device is made for cheap transportation. We pack it. There are a few connection points that is disassembled, 4 to be exact, 4 connection points, and it's really compressed for transportation. So it takes very little volume. It's a heavy device, about 85 kilograms to transport, but it's volume-wise is just a little bit more than this Colibri Phototherapy, which give you the idea how compressed it is for transportation. It saves a lot of money when you ship it by sea, by air, not as much, but by sea, and it is very big price factor in general for those kind of devices. So yeah, I try to be quick and start you off. I hope you have better idea about the devices, but now please free to ask questions. I think it's gonna be, I can be as precise as you want, as detailed as you want. So this is all very high level presentation.
So can you talk a little bit about what the warranty you offer on your products?
We offer a standard 1-year warranty for our products, and it's global coverage. Wherever it happens, we react in and servicing the device for free the way we want, usually with the assistance of our partners or people we have in place. And we do a lot of remote assistance these days, even very remote places, sub-Saharan Africa. And the good thing is about the device that they're really durable. There's not that much to break. There's no moving elements. There's a lot of things that are stable, and there are a few elements that is wearing off. And warranty doesn't cover the wearable parts. For example, patient circuit for CPAP is a wearable. It is expected to last for about 150 cycles of autoclaving, but as you can imagine, there are certain exclusions that cannot be part of the warranty service. And obviously, if the device breaks by heavy-handed people, somebody dropped on the first floor, then it's not included as well. Our warranty policy is definitely defined, is clearly defined when customer asks. But standard 1-year warranty.
Great, that's perfect. Again, just a few questions related to the company itself. For your products across the full suite, are they all CE? Is there any other registration or regulatory approval that you have associated with any of your products?
Yes, we have all the devices have CE mark, and all the devices have also something what's called certificate of free sales. That's issued by local authorities in Vietnam. In addition to that, we have a number of registrations in other countries in Asia, mostly in Asia, to Indonesia, Malaysia, Singapore, Thailand, Philippines, and that's pretty much it.
Okay. And then there's just a few about just where the products are actually manufactured and where they ship from.
Mm-hmm. The products are manufactured here in Hanoi, next to the office I sit. We have the assembly plant. Obviously, most of the components come in, they are made for us in the factories around Vietnam, but also we importing the whole electronic. Every single electronic component is imported, mostly from Singapore, Malaysia, US, but we populate PCBs right here in Vietnam, and the devices are made and packed here in Vietnam, Hanoi.
Okay, perfect. And then there's a lot of questions about each product specifically for spare parts, consumables, accessories. So for those on the line, anybody that's asking about pricing or orders, things like that, please follow up with us directly and we can talk to you on that. But I guess the question that people have is, for all of your products, you also stock and supply any spare parts and consumables, that it would all be basically buying from the same manufacturer, same supplier. It wouldn't have to be sourced separately.
Of course, yeah, everything is supplied by us, including consumables, those few consumables that we do have. For Dolphin CPAP, it's that nasal cannula, that is the consumable. They're reusable parts, but also can be sourced. They last 150 cycles, we're talking about 2 years probably, depending on the hospital. And one part, oxygen sensor, the same kind that mechanical ventilators have. So this part have also limited lifetime, but it's very easy access, just screw that in and out. And
jumping into Firefly next, kind of a similar question, I guess. But the question's related to, is there a maximum size for the baby, and related to who can use this, mostly in relation to the bassinet for a weight or length question.
Yeah, so the bassinet seems smaller, but it's not. The device is specifically designed to fit one single patient. It's a lot of good reasons behind it. We want to avoid cross-contamination, and we want to make sure there's no more one patient here, because we can see a lot of cases where there's a lot of 2, 3, 4 patients under a single phototherapy. So this is the purpose, that the bassinet is not as big, but the bassinet will fit the biggest newborn, at least the one I've seen in my life. So it's about 52 centimeters long, which is good enough for the really long babies born, and there should be no issue with that. There's no limitation on the weight, although obviously if you step on it, it's going to be, maybe it's not going to be as strong, but the heaviest newborns will be probably 5 to 6 kilograms. That will be like really extreme. And this machine itself is 17 kilograms, so, or 13, I forgot, 14. But it's strong enough to hold to the tallest and heaviest patient I've seen in my life, at least.
Okay, perfect. A few, I guess, queries about both products, but related to the bulbs, are they easily replaceable? And then the second question would be, I guess, related to, does it need to be a technician, or could just any provider replace these, and what's the process for replacing bulbs?
Well, the bulbs are not easily replaceable because these are LED bulbs. So I will try to show you LED bulbs. If we made it individually, it will be quite expensive to be easily replaceable. They are on panels of 4. So there are LED panels of 4 bulbs. If one is maybe not necessary to replace the whole panel yet, you just have to measure the light intensity. Maybe still good enough. However, if you really want to replace, you're replacing the whole panel, which have a little bit of more electronics there. It's easy replacement. It's a little bit of soldering required, but not too much. So far, we were giving that only to authorized representatives. Authorized means that had training with us, and we were comfortable with them doing this job. That's our strategy at the moment.
Okay, that's perfect. And then I guess it's questions kind of following on what we talked about for Dolphin, related to, is there any timers or alerts or alarms that are built into this device?
Yeah, it's very simple alarm system. It's just a timer that's counting up. When I turn it on, I don't have power here, but when I turn it on, you're gonna see the total number of hours, that the lifetime of the device for first 3 seconds, and after that you're gonna have the treatment therapy time. And the alarms are only related to internal failures. So I never seen any of them, but if any electronic component will fail, it will be alarming. Then not required, other alarms are not required because the light is so visible that if it stopped working, you can see that it's just not working, as opposed to Dolphin CPAP, where you're not sure if it's working or not. Forgot to say that, definitely don't put it underneath regular warmer. Some people did, and this is not working like that because the heat wave is obstructed. So that's an exclusion I mentioned before.
Perfect. And it's almost a nice time, I think, to transition to Colibri, because a lot of the same questions on that one. The first one was based on replacing the bulbs. I assume it's a very similar process for that?
Yes, they use exactly the same panels, LED bulbs and panels. So if you need replacement for Colibri or Firefly, it will be exactly the same process.
Okay.
You can see them here.
Yeah. And then since they're the same process, are they also the same specs of device, or is the difference just because one is single-sided and one's double-sided?
Sources, bottom and top, which is also affecting the specs. Quickly about the source of light, they are exactly the same LEDs with the same wavelength and the specification of the light quality. It's just the intensity and the coverage that is different.
Okay, sorry, Greg. That actually, I'm hearing from a few people that their video cut out for a little bit there. So it was just the beginning of that. I got so sorry. It's it looks like the connection on your side was just a little spotty. So if you can just touch on that again quickly, talking about the difference in intensity or specification of the bulbs for Colibri versus Firefly, knowing that one's more single-sided, the other one's double-sided.
Okay, so again, the LEDs that we use are exactly the same, which means the light spectrum with the peak are exactly the same for both devices. The only difference is that in Colibri, you can regulate the light intensity because we have two modes, standard and intensive, while in Firefly, you have only single mode, just intensive. And Firefly have bottom and top lights, while this one have only light from the top, which affects also the effective treatment surface area.
Okay, perfect. And then the Colibri, you showed it earlier, set up with the Wallaby, and you did mention that the Wallaby can be transported very easily. So does that mean that the Colibri, by I guess association, would have the same ability to be easily transportable?
Yes, of course. It's on wheels and very easy transportable.
Perfect. And so I guess the follow-up question several people have asked, is there a battery backup, or does it always require some level of wall electricity?
For which device?
The first question would be for Colibri, but we can probably touch on the Wallaby as well at this point.
So the phototherapy devices, Firefly and Colibri, the Dolphin, they can have optional battery backup. It's a big battery that it's about 50 ampere hours, and which means that provide about 12 hours battery backup for Colibri and 12 hours, more than 12, probably 14 hours for Firefly, about 4 hours, 4 to 5 hours for Dolphin CPAP. That's the external unit. It's external unit, something like UPS for your computer, but a little bit bigger and heavier. For Wallaby Warmer, we don't have the battery backup like that yet because it's operated on 220 volt AC, the heater element, and that will be a little bit more complex. But we do have the small battery backup in this device that keeps the machine on without providing the heat. So just for monitoring at the time. And that's for about 2 to 3 hours. The same small battery is in the Dolphin CPAP. So we can keep the machine alive for about 3-4 hours, but without providing a heat for the heating up the gas and the humidifier. So again, this is more like for blending and some functions for monitoring. So the batteries are the big batteries that give you the whole functionality. They're optional and they can be attached to the stand or put next to the device in case of Firefly. And here, Dolphin CPAP also have a nice stand to put it underneath.
Perfect. So I guess that is all the questions I'm seeing for phototherapy. Jumping over to the Wallaby, you did answer the question already about transport on that one, so I think we can call that one. The question is just on the temperature range and how far the range would go and how easy it is to adjust that. If you can just demonstrate that quickly.
Yes, the range is from in the baby control mode. The range in baby control mode is from 34 to 7.5 degrees Celsius. So it starts as default from 36.5. Now I to the minimum. Now this is the minimum. 34 degrees. Actual temperature that sensor measure is 27.1 now. And now we can go to maximum, 37.5. The alarm doesn't go off now because we are still within 10 minutes from the warm-up time, so there are no alarms at the moment. At the moment, because we have so much higher set point than the actual temperature, should be alarm, but first 10 minutes alarm free.
Perfect. Actually, that's a good segue to a lot of people, again, having the same question about alerts, alarms, and what feature is built into the Wallaby for any alerts and alarms.
They are, again, standard alarms required by the all safety procedures. You have alarm too high, alarm too low when comparing to your set point and measured by actual temperature by the skin sensor. And you have parallel alarms on the components. For example, if we remove the skin sensor, it's a skin sensor temperature failure alarm. So those kind of things. If we have, for some reason, broken heater element here, it's gonna be the same. The alarm's gonna be ringing like a similar way. We have heater power failure. For example, I'm gonna disconnect the machine now from the power. So let me, I disconnected the machine and now we have the alarm. And this heater, it's a power failure alarm. And we can mute it, but the machine has battery, but the heater doesn't work. We have Apgar scroll alarm, just like a timer. We have, I connect back. Now I connected back, and the machine is back to normal mode. And that's pretty much it, yeah? All major alarms, and the ones that hopefully you're never gonna see related to the components failure.
I'll open it to you, Greg. Is there anything that maybe you were expecting a question on, but no one asked, and you wanted to let everyone know about any certain features or functionality?
Well, I think it's important to understand that the devices are designed for a certain context. They are, we know that where we are here in Vietnam, but also in the places across Asia and other places, Asia and Africa, they are challenges, and they are related to the lack of staff, often lack of experience or enough training, and facilities themselves. So it's very important to understand that those devices should work in those places, and we will do everything to make them as independent from the sources as possible. So battery backups and problems like that. Nobody mentioned, nobody asked, but one important function of all the devices is the additional protection of the electrical circuits that we install in our devices. We have optional surge protectors that can be installed externally to even further protect the electronic circuits from the spikes up to 400 volts or even higher, depending on the configuration. So this one we really need to protect, because when the electronic fails, nobody can fix it in the hospital just by soldering or adding few components. This one has to be sent to us. But even if they fail, we use very standard, all our devices use standard power supplies that we are external. I will show it to you. We use this kind of external medical grade power supplies that are, even if they fail, we are able to deliver them quickly and not expensive to replace. Electrical safety is very important, but we know that the electrical infrastructure is very challenging in those places. So during our design process, we really were focusing to make sure that devices can be easily fixed as well. Not only this is excluded from the warranty, obviously, because this is not our fault, not internal device fault that it broke when there was a surge spike, but we still caring about it, and at very low cost, we are able to fix devices and continue keeping them in the operations. So that's very important. Other mechanical parts, they are durable. They are really long lasting. I don't see many things to go wrong there. So I think a lot of parts we have devices like Firefly for 5 years. We've been working, and there's not a single one broken. Every device that were broken so far was due to electrical problems, including Firefly Phototherapies, and we're addressing that by sending this, basically. So that's very important. I think we should be aware of that, and you should be aware that we are always servicing the devices, and we listening to customer feedback as well. So if you have any ideas, any issues that you want to share with us, we are very happy to hear that.
Perfect. Thank you very much, Greg. I appreciate that, and really taking the time today to speak with us and answer everyone's questions. It's very much appreciated. I know there was a lot of people that asked questions, again, just on prices, spare parts, orders, things like that. Again, what we would like you to do is just go to the product page here. You can request a quote. It's just a simple form to fill out your basic customer information so we can make a contact to you directly and provide a quote. People that, again, questions about product documents, have brochures, manuals, all there, specifications as well. So we really want you to feel empowered to find this information without waiting for us. But again, you can contact us there. You can contact us on WhatsApp or email us at sales@vehiclehealth.com. All available there, and we're very happy to answer your questions offline if it relates to pricing and bits like that. But Greg, with that, I'd really like to just say thank you again, and thank you for your time and for your thorough demonstrations. And for everyone else on the line, thank you for your questions. It definitely was appreciated. I know people are taking time all hours of the day. So thank you, everyone. And we look forward to you on the next training series.
Thank you very much. Thank you. Bye.